It is recording on my computer, and we'll just cut it off until it's time. So,
should we start?
You're muted, Dia.
let me pin you, Alice, and then yes.
Okay.
And hide myself since I'm not talking. And you are good to go.
Great, thank you. Hi, everyone. Welcome to our ARRB Lens seminar series. I'm very excited to bring this group together, and we're going to be talking about our primary care services and quality node. Next slide, please. My name is Alice Kuo, and I am a professor and chief of medicine pediatrics at UCLA and the principal investigator for the Autism Intervention Research Network on Physical Health. I am also a director of the University of California LEND program. I am an Asian female with medium length Black hair with a navy blue scrub shirt on, and I'm sitting at a desk with a bookshelf of books behind me. Next slide, please. I'm joined by Drs. Lisa Schulman and Tony Whitaker, both of whom will introduce themselves later on in the seminar. Next slide, please. And we also have special guests, Helen Rotier and Vanessa Gonzalez, joining us for the seminar as well, and they will also introduce themselves later on in the seminar. Next slide, please. The learning objectives for this seminar are to, number one, review the need for all healthcare settings to be autism friendly, serving individual and family needs from early childhood through the entire lifespan. And this is recognizing that autism prevalence is now 1 in 44 as defined by the CDC, or roughly 2% of the population. Next slide, please. Our second learning objective is to explore strategies for making our healthcare settings more inclusive with input from autistic individuals and family members of autistic individuals. Next slide, please. Our third learning objective is to learn about current research topics within the ARRB primary care node, such as managing needle anxiety and addressing healthcare needs non-traumatically. Next slide, please. So the overall goal of the primary care services and quality research node are to increase the lifespan and maximize the quality of life of autistic individuals. In order to attain these goals, primary care for autistic individuals needs to improve. Next slide, please. I'm turning it over now to our special guests, Vanessa and Helen, if you would like to introduce yourselves.
Thank you. My name is Helen Rotier. I'm a PhD candidate in disability studies at the University of Illinois, Chicago, and I am an autistic adult and a person with intense medical phobia. I want to talk briefly about an experience I had in fall of 2020 when I fell down the stairs at my parents' house and broke my ankle and needed to have surgery. Now, in 2020, because of the COVID-19 pandemic, hospitals weren't allowing support people into clinics with patients. And I was forced to go through with my surgery without any of my family or support people present. For someone with intense medical phobia, that can be really challenging and could be challenging for someone without medical phobia as well. So I spent one night and most of 2 days in the hospital for my surgery. And I was really lucky that most of the nurses and doctors seemed to understand my fear, and they were really compassionate But that's not always the experience that autistic and medically phobic patients have in primary care or emergency care spaces. Many patients report scenarios where because of how they're perceived by doctors and nurses, they are assumed to be overreacting to the trauma that they're experiencing in the medical context. And so, because I'm a graduate student, because I live independently, doctors and nurses and other healthcare professionals assume that I can handle being in healthcare situations without fear. And that's just not true. And I think what's important to take away from that is that you don't know what someone's situation is. Autistic patients look just like your non-autistic patients, and everyone around you is going through these different scenarios and different levels of comfort and fear with healthcare settings.
Thank you so much for sharing that, Helen. I think that's very illustrative of the experiences that many autistic or neurodivergent patients face. Thank you so much. Vanessa, would you like to introduce yourself?
Hi, I am Vanessa Gonzalez. I am a Hispanic female with short brown hair, and I'm sitting at a desk, and in back of me is a wall of pictures of my children. First, I want to say I am a parent of 3 children with autism. So as such, they all have different levels of functioning, and I have different levels of care associated with them. So my experiences with primary doctors are all radically different. I like to say that there are 3 stages in the parent's life, not the child's life, 3 stages in the parent's life with autism. And the first stage is the diagnosis stage, which is from diagnosis and maybe about the next 2 to 3 years. The second stage, I like to say, is just like the cozy stage. Everything is going great. You understand what's going on. That's the best stage to be in. And then the final stage, which is transition, which is a very difficult stage. It's so similar to the first stage of diagnosis. So with my first child, before I was experienced in the world of autism, it was very, very difficult just to function normally. I was given a diagnosis, my son was given a diagnosis, and after that, you just pretty much left hanging in the air. There was no support services offered. Everything that I ended up learning, I learned from other parents, from connecting with people in the playground. I didn't have a great doctor for my son when he was growing up. It was pretty much trying every single doctor there was out there. And I regret a lot of the medical experiences that I had with him early on. My second child, who is severely autistic, wheelchair, non-ambulatory, nonverbal, really self-injurious. When I was approaching medical care with him, I felt like staff was scared of him in a lot of ways. When it was time for blood draws, he was getting restrained by myself and maybe 2 or 3 other people just to get his blood. And I wish at that time I would have known more and I would have advocated more to have a more humane way of getting his blood. But yeah, he was restrained oftentimes for blood work, for medical procedures, for examinations. And I truly feel bad about that. So I think there's a lot of education that needs to be done for medical staff and not just go to the saying, let's restrain him first. That shouldn't be the first option. By the time I got to my third child, navigating the system was great. I already knew everything there was to know, and you couldn't faze me. And then reality hit again upon transition. So my oldest son, when I found out he was aged out, because you don't get prepared for that either. The primary doctor doesn't say, oh, next month you're gonna age out, so you have to go to an adult doctor. So he didn't have care for quite a long time because I didn't have access to an adult doctor. When I did find an adult doctor in network, the first thing she told me was, I need you to step out of the room because I need to examine him. And I said, well, he's disabled and I need to be present because he would, have a panic attack if I'm not there. And she didn't believe me. He had to tell her, I want my mom in the room before I was allowed to stay in the room. I have a feeling it's because he is functional to a point, but he does have a lot of phobias. And that wasn't considered. She didn't even acknowledge my response to his needs. Same thing with my second son. Finding care for him was extremely traumatic, and the office that I was sent to was not it was wheelchair friendly to an extent, but there was too many chairs in the office and not enough space to have him separate from other people. He was screaming in the office. And people just looked at us like we were alien. So definitely there has to be some changes to happen, and for more medical providers to understand the differences that people need, the difference in care. Thank you.
Thank you so much, Vanessa. I mean, you gave such compelling stories of each of your children and their experiences. And I think that's the perfect segue into what we're going to be discussing with Dr. Schulman and Whitaker, because this is a real issue that the autism community faces, is finding primary care providers. In order to navigate the rest of your life, you need to have primary care providers who can look out for your health needs. So turning it over to Dr. Schulman and Whitaker to introduce themselves.
Hi, my name is Dr. Lisa Schulman, and I'm a developmental pediatrician. I'm the director of the Rose F. Kennedy Children's Evaluation and Rehabilitation Center at the Children's Hospital at Montefiore. And I'm here in the Bronx. I am a white woman with straight brown hair and bangs. And I am sitting behind me is my messy office. I'm going to turn it over at this point to Dr. Tony Whitaker.
Hi, y'all. I'm Tony Whitaker. I'm also a developmental pediatrician. I'm in Memphis, Tennessee. I practice as a developmental pediatrician. I'm the chief of developmental pediatrics, but also the LIN director here at our Center on Developmental Disabilities at University of Tennessee. And it is a pleasure. Oh, sorry, let me give my description. I can't top Dr. Schulman's office comments. My office that I'm sitting in has a large plant and a map. I'm a white woman with brown hair and bangs, and I'm wearing glasses and a dark shirt. I'm really glad that we're able to share perspectives of all of these voices today. I think we had a moment to have Dr. Quo talk a little bit more about the nodes, or we can jump right into the topics we had hoped to discuss today. Is that okay, everyone?
I think we can jump into the topic. I would say that for the benefit of our LEN trainees, this particular research node is interested in studying anything that will make the primary care experience of autistic patients better. And that could be talking about addressing the visit itself. It could be talking about inclusivity and the way that the health system can, acknowledge the needs of autistic individuals, like sensory needs or any other types of needs. We have projects also looking at the intersection of autism and race because of microaggressions and other discriminatory behaviors that could happen in the primary care setting. So we also have educational interventions for educating primary care providers and office staff. So these are the types of research projects that we have going on in our primary care services and quality node. And I think listening to this particular seminar will give you all a better idea of why our research agenda looks like this.
Thank you, Dr. Cohen. And I'll say that as a professional working in a specialty field, I try my best to keep an eye out for not only the needs of the patients and families I serve directly, but I really need to connect with their primary care system, their medical home, their clinicians, so that I know what they need at the various levels. With our LIN groups having such a diverse array of disciplines involved, your experiences with primary care or medical care in general may have varied quite a lot. So that's we had hoped to bring to you today some of the voices to give some of the perspectives around that care. It could be primary care, but also a lot of times primary care intersects with that specialty care. I do think as the variety of specialists that we are, and as you as trainees are, we have some responsibility to make sure we know what families have available to them and how we could potentially help and give some anticipation for what's going to come next or how they can interact with those systems to make things the best. So happy to hear other perspectives of that as well.
I'm always struck by how the current issues with individuals with autism having challenges accessing good primary care really gets at the core of the whole LEND mission. So when we're writing out our grants and progress notes, it's all about increasing the workforce available, trained in interdisciplinary care of individuals with autism and other developmental disabilities. And so you are LEND trainees. This is kind of, you're at the crux of this entire issue. I think education and giving people from the earliest point on the vocabulary and experience and the ability to hear from individuals with autism and family members who have lived experiences can awaken an interest and certainly develop a comfort right from the start that may impact their entire course of training and then the direction that professionals choose to go in terms of providing clinical care. We're talking now about what can we do to make our primary care settings work for people with autism, make them more inclusive. Vanessa, you personally covered all the 3 stages we wanted to. Diagnosis, transition to adult care, and Helen, you chimed in with the biggest issue, or one of the biggest issues about challenges about accessing appropriate health care as an adult. Can you give us your views on what are some additional challenges that you feel our families and individuals with autism face in terms of accessing a more inclusive and positive primary care experience?
I could go first. One of the main issues that I do have is with setting, not even the doctors, the office setting itself. So one of my child, she doesn't like noise, right? The setting is there's 2 TVs on in the waiting room with 2 different television shows on. There's a ton of kids running around or screaming. There's nurses calling out names from this specialty, from that specialty. It's a very, very chaotic scene in the doctor's office sometimes. The best thing that could have helped me would have been someone to say, hey, you know, can we go to, do you want to be placed in a room so you could wait in a room? That would have been so helpful. Instead, I have my child going underneath my shirt, trying to block out all the stimuli that's going on. I think especially like front end staff, I know it's not their job, but they should recognize if there's a child having specific difficulties, and offer a safe space to go, just to desensitize. That's my opinion.
Helen?
Yeah, I totally agree with the making the sensory environment appropriate for every patient, for every child, and for every adult patient. And I also think something that I want to reinforce in this conversation is that access comes from choices. Having choices for how you engage with the medical care system. And so specifically, I'm thinking about the difficulty many autistic adults have with making phone calls. And so if you have to make a phone call to schedule an appointment, I personally, and I know many people who will simply not make that appointment because the phone call is such a barrier to access. My chart has been a blessing for me because I can schedule appointments on my computer, and that's fantastic. And just having those choices, because for someone, my chart might not be the most accessible pathway to access. For someone, the phone call might be more accessible. And having choices, having these opportunities for people to choose what works best for them is one of the keys to ensuring access. You know, the other piece that I'll share is giving information to the patient and getting informed consent when you're doing some kind of like primary care procedure. You know, a primary care exam is probably going to involve a healthcare professional touching the patient, and that's okay. But explaining what you're doing and sometimes why you're doing it can be helpful. Additionally, some people want to know more about the process and some people want to know less about the process. So just gauging that with every patient can make it a better experience for those patients.
I want to add, you know, those are such basic, simple things. The idea of having longer hours, having some early appointments so the waiting area won't be as full, or late appointments, having a separate space in the office that's either being able to room a patient quickly if they have sensory needs, or a separate space to wait that's a little quieter. Another thing that came up was having it in Epic or whatever documentation all office staff have of indicating that a patient has these needs or preferences. That's a direction various facilities, our own included, have developed an autism or developmental disability passport that would be accessible to everyone from the front desk to clinicians of a variety of disciplines and support staff, making that something that's just known and therefore can be accommodated.
Dr. Schulman, you make a fine point about those accommodations, and regardless of diagnosis or where a family or child is in the process of receiving a diagnosis, sometimes those accommodations are very reasonable to ask about and to expect from medical visits. And it would certainly be nice for us all to work together to make that environment friendly to folks who need help of various sorts.
One other comment, we had the nice opportunity to discuss things before we got into this formal video. And I think it's worth being careful about our language. These days in the news, world events, concern about aggressive behaviors in individuals with autism and developmental disabilities has kind of seeped into some people's thinking. And one of the things that I think we can do as leaders in our field and future leaders in our field is to reframe that as dysregulated behavior, that they are sensitive, and that this is not an aggressive intent, and kind of utilizing our language well to educate and normalize and view this as something that the environment may be contributing to, and the individual themselves or their family can help us problem solve how to make this a comfortable experience. Another topic I want to bring up is, it came up a lot during COVID, simple procedures in the hospital. So we brought up and heard about blood draws. What about things like COVID testing, COVID vaccination, or an individual who, for primary healthcare in adults needs their mammogram, needs their gynecology exam. What can we do at settings that are part of primary care need that would be helpful to individuals with autism and their families? Any thoughts on that, Vanessa?
Again, there's just different stages of care. So what works well in a younger child setting is not going to work well for an adult setting. As far as adult setting goes, I think it's important that adult practitioners understand that their patient is not like every other patient. And yes, take the extra time to explain things. Take the time to, if the parent is present or the caregiver is present, to explain to the caregiver as well, because oftentimes we are the ones that are doing everything for the patient anyway. As far as younger children goes, I actually like the idea of having the younger children start advocating for themselves early on, and having the doctor, the pediatrician, listen to the child, because they could give you good information. A lot of the times the practitioner just goes straight for the parents and ignores the child. And it's a simple thing of just asking the child, how are you doing? What's hurting you? It doesn't feel good to be ignored by your practitioner. Thank you.
That comes up a lot with medicine. You need to take this medicine. Would you rather have it in a liquid? Would you rather have it in a capsule? That idea that primary care providers may address a parent rather than the child also extends, I know, to many of the adults we see with autism and developmental disabilities who feel unseen and unaddressed.
And really, if we think about it, we all prefer to have some choices, and to help families and individuals with autism or other disabilities help find their voices. If we can help educate the medical community around, or even help those individuals tell their story from their perspective, I think no matter our specialty, we've got a role there.
Yeah, I think it's really important to educate. And I think, again, the fact that this is LEN trainees that we're talking with, to educate everyone in the office about sensory needs, about anxiety, and that it's not necessarily autism specific either. We do have patients who really don't like coming to the doctor, and they don't they're not autistic. I mean, I think it's just a common thing. People don't, there are lots of people who don't like going to the doctor or going to the dentist, and yet to be healthy, this is something you just have to do. And I think on the healthcare system side, with more training, every touch point that a patient encounters is meaningful. So from the front desk, from the moment you come in and you talk with the front desk person, and then you talk to a medical assistant to get your vitals, and then the nurse that's going to administer the vaccines, if each one of those touch points is successful, if each one of those touch points acknowledges autistic people and children, appropriately, then I think the overall experience is a good one. So one of the important trainings that we've done in our primary care clinic is to have the medical assistants and the nurses not tell kids that the shot is not going to hurt. Because I think when a child is anxious and showing signs of that anxiety, to have a nurse just say, oh, it's not going to hurt, dismisses that child's very obvious concerns, right? So, we have had behavioral psychologists come and do trainings with our nurses to say, it's better to acknowledge their distress and to say, it might hurt for a second, but then it will be over. And how can we help you with that? Do you want to take a few deep breaths? Do you want to watch a video while I give you your shot so that you're distracted and not thinking about it so much? And there are other strategies like EMLA cream, right? So with preparation, with advanced notice, if you prescribe the EMLA cream before the visit, the parent can apply it at home with an occlusive dressing an hour before they come in, and then it's numb. And maybe that alone gives the parent and the child some relief from their anxiety so that this very brief procedure wouldn't be so distressful.
Alice, can you tell us more about how the ARRB primary care node is going to seek to address some of these questions and issues?
Yeah, so we are doing an intervention, right? So it's the Autism Intervention Research Network. So at UCLA Health, we developed a needle anxiety protocol because I don't know, it sounds as though the experience is similar in many other health systems across the country. But before we developed this protocol, the standard response for patients who had difficulty with, these primary care procedures like blood draws or vaccination was to go to the lab, the one lab in Westwood where there were enough big adults around to hold patients down. And this could be children after the age of 8, because sometimes you get some big 8-year-olds, right? And I think the challenge I had with that when I discovered that that was the official approach is that it's, number one, undignified for the patient, and number two, not safe for the medical staff trying to, draw blood or give vaccination with a flailing patient, and that is just physical restraints. And so we have looked for different ways to reduce anxiety, such as I mentioned, the distraction techniques, the deep breathing, training our nursing staff so they're not so dismissive, and then doing things like EMLA cream. So we have sort of a tiered approach with the least invasive to the more invasive, which is then inhaled or nasal midazolam or Versed. And so the whole point of our ambulatory nursing protocol was to allow for inhaled or nasal midazolam to be given in a primary care setting, because it's often used in the emergency department for brief procedural anxiolysis. And we, after many, it took us 2.5 years to get this protocol approved. And we're happy to share it with anybody who wants it. And it requires sign off by the emergency department, by anesthesia, by, all the nursing leadership. But we finally have it in place. And as I mentioned earlier, our very first person to use the protocol was not neurodivergent at all. She was a 30-year-old woman who had had procedural anxiety her entire life. And she came to this particular clinic because she said, I know I need to get my blood drawn, and I know it's just going to be really tough, and I need this extra help. And I think these are the kinds of interventions that we're looking for that will make the primary care experience better without sacrificing quality. The other challenge that I have is that we had primary care providers, pediatricians and adult providers alike, for whom they would say, well, this patient has such a difficult time getting blood. We don't really need to look at that level. And I'm like, why? Like, if we need it, if that's standard of care, we should not sacrifice standard of care. We should figure out a way to be more inclusive and to meet the needs of patients so that they can have these procedures. And so this is basically a brief overview. Thank you to our guests for being part of this and educating you all about the type of research we're interested in our primary care services and quality node. Next slide, please. You can connect with any of the physicians, the providers in this seminar, and I absolutely have to give a huge shout out and thank you to Helen and to Vanessa for sharing their experiences and giving you a sense of what it is like as an autistic individual or as a parent of autistic children when they interact with the primary care setting. And this is their contact, and these are their contact information as well if you'd like to contact them. Next slide, please. And then if you are interested in learning more about the ARRB, this is all the different ways that you can interface with us on social media. I would like to give a plug for some of the different programs we have in the ARRB that trainees could potentially participate in. We have 2 research days a year, one with the AUCD National Conference, which is in the later fall. So this year is in November, and also one in the summer with the CARES conference. And at each of these conferences, we have dedicated sessions, a poster presentation session, and some plenary talks focused on the type of research that we're trying to promote for autistic individuals. And the overall goal of the ARRB, as I mentioned, is to promote the health and well-being of autistic individuals. And so those research days are opportunities for you to learn more and maybe submit some of your work and present there. We also have an ARRB Scholars Program. So if any of you are interested in perhaps getting a little bit of funding to do a project that is compatible with one of our nodes, look for our scholars program and you would be able to join and be mentored by autism researchers across the country. And then finally, we have an annual supplement in the journal Pediatrics. Our goal is to publish a supplement every year during April, which is Autism Acceptance Month. And we highlight the type of work that we've been talking about today on this seminar, very applied, applicable research that will affect and improve the lives of autistic individuals. Thank you so much for your attention. Any last words from any of our speakers?
We feel honored to have Dr. Alice Kuo with us. She's the PI on the whole shebang.
Thank you so much. And thank you so much to everyone for your attention. And thank you to all of our speakers. Have a great day.